This week on the Frontiers of Medicine. They're young, they're carefree, and half of them already have the beginnings of Alzheimer's disease.
We are about to suffer an epidemic of Alzheimer's disease.
It can strike anyone, from heads of state to heads of households. Can it be prevented?
The ticking time bomb is a good metaphor for Alzheimer's disease.
Does it have to be a death sentence? Alzheimer's disease, possible causes and possible cures. What is known and what is suspected in this special edition of Frontiers of Medicine. Funding for this program is provided by the Medtronic Foundation, celebrating Medtronic's 50 years of pioneering therapies that restore health, extend life, and alleviate pain. Medtronic, when life depends on medical technology. Now, here's your host, Dr. Louis Sullivan.
Welcome to Frontiers of Medicine. Alzheimer's disease. More than 4 million Americans have it, and it's believed that at least twice that many will have it by the year 2020. It wreaks havoc on patients and families alike. As of yet, there are no cures for Alzheimer's disease. To find the cure, doctors must work feverishly to find the cause.
Alzheimer's disease. We all think we know what it is. We all think it's when you become more forgetful as you get older. We all think it's an old person's disease. And we are all wrong.
I would worry about it as a long-term problem, but not in the immediate future. I thought it was someone that affected people in their old age.
Definitely older, like probably over 70, you know. I would think it's more of an older person's disease.
Who is that? Huh? It's you? And me?
Alzheimer's disease is a form of dementia. Its symptoms include a loss of memory, a deterioration in cognitive abilities, and marked personality changes. Sufferers begin reverting to childlike behavior, and if they live long enough after diagnosis, they'll need round-the-clock care and supervision. Alzheimer's impacts families and caregivers like almost no other disease.
I've got the CT scan here.
It costs American society $100 billion per year in medical, personal care costs, and lost wages. And as the baby boom generation ages, Alzheimer's threatens to become an epidemic, striking millions of people over the next 2 decades and costing society untold billions of dollars.
We are about to suffer an epidemic of Alzheimer's disease. Right now, we estimate there are about 4 million people in the country with Alzheimer's disease. By 2050, there could be as many as 14 million. That probably is enough patients to simply overwhelm both the societal and personal resources that we have to devote to the problem.
Yet despite the dire predictions, the American public remains largely unaware or unworried by the potential threat. When asked if they feared developing Alzheimer's more than any other disease, just 10% of the respondents in a Frontiers of Medicine Telephone Strategies Group poll conducted for this program said they feared the onset of Alzheimer's more than any other disease. That's 37 percentage points less than those who worry that they'll develop cancer. And only 9% said Alzheimer's disease was the biggest health threat to society, compared to 52% who said they feared cancer most.
You're right here. There you go, now squeeze.
But Alzheimer's disease is not just a disease of the old. Although almost half of Americans over the age of 80 have it, Alzheimer's can actually begin decades before the symptoms become noticeable, sometimes as early as your 20s. At least, that's what Dr. Zavin Khachaturian thinks. One of the world's leading authorities on Alzheimer's disease, He's even gone so far as to say that 2 of every 5 people in their 20s today have the beginnings of Alzheimer's disease. They just don't know it yet.
The ticking time bomb is a good metaphor for Alzheimer's disease. The question is, when does the time bomb start ticking? Recent evidence shows that it can start as early as people in their 20s and 30s, and perhaps majority of them have started many years before we can detect it.
Although researchers are not sure of the specific causes of Alzheimer's disease, this is what they do know. Alzheimer's develops in the hippocampus, the region of the brain that regulates learning and memory. Autopsies and new scanning technologies show that the brains of Alzheimer's patients have a smaller hippocampus than those of non-Alzheimer's patients. One of the reasons the hippocampus is smaller is that it has fewer brain cells, or neurons. It's suspected that some brain cells of Alzheimer's patients have been killed off by excessive production of protein fragments or peptides known as beta amyloid. Beta amyloid clumps join with dead or dysfunctional brain cells to form impenetrable plaques which block blood flow to the brain cells, effectively starving them of necessary oxygen and glucose. The beta amyloid plaques in the brains of Alzheimer's patients are similar to the plaques that clog arteries and cause heart attacks and strokes.
The reason that the brain vasculature may play an important role in Alzheimer's is that the blood supply to the brain is made available through large vessels, then progressively get smaller, and these vessels through the blood make available glucose and oxygen. And if you deprive the brain or nerve cell of glucose and oxygen, you put the neuron or the nerve cell in great risk for damage.
In addition, nerve cells become strangely disorganized and bunched up like a rope tied in knots. The nerve bundles are called neurofibrillary tangles, and it's around them that the beta amyloid plaques form. But what causes the plaques and tangles to form in the first place? And what causes the excess production of the beta amyloid protein? Despite some tantalizing clues, those questions still have researchers stumped. Doctors feel there are several possible factors which, acting independently or in concert, may contribute to Alzheimer's. The first is a genetic link. So far, most of the genes that have been linked to Alzheimer's relate to the early onset form of the disease. But at least 2 genes are suspected of contributing to the development of Alzheimer's after age 65. And one of them, APOE, may also contribute to the development of heart disease. But even in the rare cases where a strong genetic link has been established, genes by no means tell the whole story.
You're talking about a few hundred families where there's an already identified genetic cause of the disease. It's only in those cases where multiple individuals in a family, a parent, brothers and sisters of that parent, and several children of those parents in that family all develop Alzheimer's disease, that's where you have a likelihood of an actual gene mutation that causes the disease.
I'm going to ask you to remember 4 words for me.
But that likelihood only translates into a 50% chance of developing Alzheimer's in those persons with that gene mutation. Clearly, genetics alone are an imperfect predictor of risk. Studies done on identical twins with identical genes show that if one of the twins has developed Alzheimer's, there's only a 50% chance that the other will too. Even more puzzling, even if the second twin has Alzheimer's, the disease usually progresses at different rates in the 2 individuals. Even for patients where there is no known genetic predisposition, there is still a strong possibility that still to be discovered genes may play a role in the development of Alzheimer's disease.
There is a significant increase in your risk if you have a parent. It's about 3 or 4 times greater risk. However, the overall risk of getting Alzheimer's disease is only about 5%. Because only about 5% of the elderly population have Alzheimer's disease. Therefore, your risk might go up to 10% or 20% of getting the disease if you have a parent who developed the disease.
Further complicating the Alzheimer's puzzle, theories on other factors that may trigger the disease abound in the scientific community. One such theory involves bacteria. Researchers at two independent sites, Johns Hopkins University and Allegheny University, discovered a specific bacterium in the brains of 17 of 19 Alzheimer's patients they autopsied. The same bacterium that is also found in the fatty plaques that clog heart arteries. They suspect that in responding to the threat of the bacteria, the body produces chemicals to fight infection, which cause inflammation of brain cells, one of the possible factors contributing to the development of Alzheimer's. This finding became even more significant when 18 of 19 samples from non-Alzheimer's brains showed no signs of the bacterium. But bacteria may not be the only microscopic trigger. In 1997, British researchers presented a possible link between Alzheimer's disease and the virus that causes cold sores. Some theories are even based on certain environmental factors. Researchers think that toxins in the environment, such as air pollution, may even play a role in developing Alzheimer's. Another study, conducted by Dr. James Mortimer of the University of South Florida, identified a relationship between Alzheimer's and childhood poverty. His findings? The chance of having Alzheimer's disease is as much as 32 times higher in people with a family history of the disease who also experience poverty in childhood.
What we found is that lower education or poverty by itself was perhaps had some association with your risk of the disease. It increased it 2 to 3 times. Having a family history of the disease increased your risk 3 to 4 times. Whereas if you had both of these risk factors, that is, if you came from a poor family and you had a family history of the disease, this has increased your risk 32 times.
Some experts feel that inflammation in the brain can lead to Alzheimer's, a point also expressed by Dr. Muriel Gillick, a physician at Boston's Hebrew Rehabilitation Center for Aged, and author of Tangled Minds, Understanding Alzheimer's and Other Dementias.
The characteristic findings in the brain of someone with Alzheimer's disease are plaques and tangles. Maybe these substances that are there set up an inflammatory response, and that's what destroys nerve cells.
Trauma to the head from falls or blows may also contribute to the development of Alzheimer's disease.
We find that people who have had a serious head injury at some time during their lives, which leads to unconsciousness, have about double the risk of getting Alzheimer's disease when they're older.
And lastly, a patient's diet and lack of exercise may contribute to the onset and the ability to cope with Alzheimer's disease. Elderly people who engage in regular exercise are less likely to have Alzheimer's disease than those who lead a sedentary lifestyle. Whether just one of these factors can bring on the onset of Alzheimer's, or whether several of the factors need to work in concert, is not yet known.
Diagnosing Alzheimer's disease is an inexact science, but early diagnosis of the disease can delay its onset for months or even years.
Right now, there is no completely accurate way to test to see whether patients have Alzheimer's disease. For the most part, doctors diagnose it by excluding all other possible reasons for dementia. And even then, the diagnosis is likely to read dementia, probable cause, Alzheimer's. Even autopsies are not 100% foolproof for diagnosis, but without an autopsy, there's no way to tell definitively that a patient has the plaques and tangles characteristic of Alzheimer's.
Because really, until you do an autopsy, you cannot definitively diagnose a dementia. You can lean in one direction or another based on the constellation of symptoms, and that helps, especially if there are drugs that you want to try, but you can never be 100% sure about your diagnosis.
Doctors may be able to push diagnosis back 5 years or more by simply fine-tuning their tests for cognitive impairment. Until now, doctors used a number of memory games to test for the symptoms of Alzheimer's.
I want you to tell me all the words that begin with the letter A in 1 minute.
A, able, about, above.
Another favorite test is to ask patients to draw the face of a clock.
Clock drawing is a great test because it taps in on a lot of different functions. It taps in on somebody's visual spatial skills. It taps in on someone's ability to organize information, to organize the structure of a clock, to be able to put the hands and set it at a certain time. So you really need a lot of help to be able to draw a clock. And if your clock is normal, clock drawing is normal, you know that person has a lot going for them, and you feel reassured.
Dr. Ronald Peterson of the Mayo Clinic in Rochester, Minnesota, has developed a test that is more advanced than just clock drawing and almost as reliable as an autopsy. Unveiled at a press conference in March of this year, the Mild Cognitive Impairment, or MCI test, is the foundation for a new high-profile study.
Is your loved one's memory loss normal?
Well, I know it's around here somewhere.
Or is it something more serious?
Didn't you just have the checkbook? I don't remember. Could you have left it at the grocery store again? I don't know.
Could it lead to Alzheimer's disease? Does it have to? To find out more about participation in a memory loss investigational study, call 1-888-455-0655.
Some of the questions will be easy and then some will be hard, and you may not know all of the answers, and that's okay.
During the clinical evaluation, patients undergo a battery of neuropsychological tests that are designed to give doctors a roadmap for the diagnosis of Alzheimer's.
Persons with a mild cognitive impairment fit between what we feel is normal aging and very early Alzheimer's disease. By that I mean these individuals have a memory impairment beyond what we'd expect for normal aging, yet they're not impaired in their other activities of daily living. But by the virtue of their memory impairment, they are at an increased risk of developing Alzheimer's disease in subsequent years. The implication of this study for Alzheimer's disease research is that it identifies a group of persons who are at increased risk for developing the disease. This may have implications for treatments in the future. This is the group of individuals in whom we would like to intervene with an effective treatment in an attempt to prevent their subsequent development of Alzheimer's disease.
At about the same time that Peterson was making his announcement, researchers at the Southwestern Vermont Medical College's Memory Clinic announced their new diagnostic test, called the 7-minute screen.
Russell, I'm going to show you 4 cards. Each card will have 4 items on it.
The test consists of 4 separate components that measure a patient's cognitive abilities. Researchers are claiming that the test is simple and inexpensive enough to become part of a regular physical exam for elderly patients. Alzheimer's would then, too, be easier to diagnose if a simple blood or urine test were available. Researchers at Nymox Pharmaceuticals of Rockville, Maryland, claim they have developed such a test. The first version of their test measures for a brain protein known as NTP, which Alzheimer's patients have at a level 10 times that of the general population. But because the test required a cerebrospinal fluid sample, it was expensive and uncomfortable. Now, Nymox has developed a simpler, less expensive urine test that they claim is just as accurate. While many in the Alzheimer's community remain skeptical of the Nymox test, if proven, it will herald a revolution in Alzheimer's diagnosis and treatment. In addition to the other companies working on biochemical marker tests, genetic tests are now available for detecting certain predispositions to Alzheimer's. But there are ethical considerations.
Without an effective treatment, I think there's a fairly warm ethical debate about whether such testing is useful. Obviously, there's some value to the patient and the family around being able to plan, but because these tests really only identify risk, they don't say you will get the disease, they simply say you have a higher risk of getting the disease. That information is sometimes not particularly beneficial to the individual.
Janet Walsh is the founder and president of the Long Island Alzheimer's Foundation. Her father had Alzheimer's, his sisters did too, and so did her grandmother on her mother's side. Janet took part in a genetic study for Alzheimer's disease at New York University. The test showed that she has a 50 to 90% chance of developing the disease. But even though there are few treatment options for Alzheimer's, she's still glad she was tested.
I feel that for me, knowing that I carry the gene for Alzheimer's disease, I don't know, I feel almost like I have a little more control. I know who the enemy is. I know how to possibly fight the enemy. I know that there's an awful lot of research going on right now as we speak that will help me fight the enemy.
New York University is one of the institutions at the forefront of another promising Alzheimer's detection device, brain imaging. Some researchers are trying to develop imaging tests that would spot abnormalities in brain chemistry at an early stage of the disease. Others are looking at the size of structure. In a study of 16 patients, NYU found that the part of the brain responsible for memory was 27% smaller in people with mild Alzheimer's than in healthy patients. Dr. Moni de Leon led the research team.
Our imaging techniques are derived from a strategy which has allowed us to link examinations of postmortem brain with MRI images of postmortem brain, so that we have a validation, if you will, of the image because we are looking at the real tissue alongside of it. This has allowed us to look at the relationships between cell loss and brain size.
These are the School Sisters of Notre Dame in Mankato, Minnesota. When all is said and done, it is likely that these courageous ladies will have done more for Alzheimer's research than anyone else. 678 members of their order living in different cities have signed up for an extraordinary study. They undergo yearly physical and mental evaluations.
Engine, butter.
Open their personal records to researchers, and when they die, turn over their brains for examination. So far, the findings have been extraordinary. An example?
Sisters, do you remember when, during the last months,
Researchers analyzed the schoolgirl writing styles from many years ago for 25 nuns who have since died. They found that those whose writings contained the lowest density of ideas per paragraph were the most likely to develop Alzheimer's. That may indicate that the disease starts early in life, in the teens or 20s, and the findings may lead to a writing test that can help diagnose Alzheimer's.
One of the initial findings of this study was that from certain characteristics of these essays, it was possible to predict with fairly high accuracy who would develop Alzheimer's disease and dementia some 60 years later at an average age of 80. The one factor that stood out among all others that we looked at was the amount of information in the essay per word of the essay. I think we all know people who can write a great deal and say nothing, and we know other people who can say a great deal with a few words. And what we discovered is the nuns who wrote a great deal and said less were at much higher risk of having Alzheimer's disease than those who packed a lot of information into a few words.
Get out of my way, I'll run you over.
For more information about Alzheimer's disease, visit our website at www.frontiersofmedicine.com or call our Alzheimer's helpline at 703-243-7942, extension 100. Next week on Frontiers of Medicine. Alzheimer's disease, Part 2. With America and the world hurtling towards a healthcare crisis, What are the possible causes and potential cures for Alzheimer's? If you have Alzheimer's, what are your options? And if you're caring for an Alzheimer's patient, how do you cope? Alzheimer's disease, from A to Z, on the frontiers of medicine.
Thanks for watching. We'll see you next week on the Frontiers of Medicine.
Funding for this program is provided by the Medtronic Foundation, celebrating Medtronic's 50 years of pioneering therapies that restore health, extend life, and alleviate pain. Medtronic, when life depends on medical technology.